during puberty, you have a lot of hormonal changes, and these hormones is what gives the woman her shape, your ability to reproduce, to have, your hormones, your sex hormones, the reproductive hormones, which we're talking about today. And, that makes you fertile, right? Now, this is normal, and there's a balance that has to occur for us women to have all what we consider to be a woman, right? Now, as you get older, there's another change of hormones, and this is now carrying you into the menopause period. And this change of hormones is that balance between your sex hormones. And in women, the sex hormones we're referring to are estrogen and progesterone. Now, I'm not going to go into the biology of all of this, right? Because it will bore you. But you do need to know the names of those hormones, because if you are treated and you get medication, you're going to need to know them. So you have estrogen and you have progesterone. Those are the main sex hormones. In men, the hormone that features more is one called testosterone. Okay? So as you approach menopause, right, which usually starts in your 50s, but it may start sooner for some women. In fact, if you were to take out your uterus or your womb, which is called a hysterectomy, you would go into menopause sooner. All right, good. So your hormones naturally start to decline as you get older, okay? The same estrogen I told you about and the same progesterone. And it is the change in hormones as you get older that is responsible for what we call menopause. So let us pause it right there. So let's just summarize again. It is our normal sex hormones that cause us from as a girl child to a young woman to have our periods, to be able to have babies. It gives us our natural shape, breasts, all of that. That's normal. That's one phase of life. We call that puberty. But as you get older, they start to decline. And we enter when we're about 50 to 55, what is known as the menopause, as they are declining. Okay? Now, usually, there is a hormonal balance. I want you to say the word balance between these two hormones, and in fact, all the hormones in your body that would enable you to go into menopause and have a decent menopause. But what I have noticed to be happening with more and more women is that they are entering menopause earlier, sooner than 50. Some women are entering menopause or having perimenopause symptoms from as early as their 30s. And they're having more severe symptoms and longer lasting symptoms. You have women having menopausal symptoms in their 70s, hot flashes, night sweats, all of those things. So we have seen a change in how this normal process would normally be and what is happening in these modern times. And I've been asking myself, is this our fate? Is it that we're going to have to be miserable for 40 years? For 40 years. And I said to myself, hell to the no. Hi, Sanjay. Hi, Nolan. So I think this from Barbados and from Belize, I think this video is going to be very informative, not just for us women, but for our men, because they truly need to understand what is happening. So let us get into some of the symptoms of this. So menopause. So when we say pre-menopause, we mean pre means before. And you know what menopause means? It means it's a time in a woman's life when her period stops. And usually as you are about to stop the period, your period becomes a little different. It becomes more irregular. The flow may change. It might be light. It might be heavy. You might skip a month or two and then it come back. So that leads up to the time that it stops. And by definition, you are in menopause when you no longer have a period for 1 year. So when a woman has no period for 1 year or more, she is now in menopause. So our question today is, why is it that period leading up to the menopause has become so difficult for women? That really is the question. And why is it so difficult at such a young age? So what are some of the symptoms of these hormones as they are reducing? So let us start with the mood. Most women complain of mood swings, irritability, anxiety, panic attacks, difficulty sleeping, or if they do fall asleep, they cannot stay asleep, depression. And these mental health issues can become very severe. It can start to affect your relationships at home, with your spouse, with your children, at work, with your co-workers. It's like you feel like a whole different woman. You're a whole different person. And I've experienced this. Like I really started to notice in the last couple of years, especially before my period is to come. I feel like a different person. It had reached a point that basically that week before the period, the menses, is like I just feel like I want to lock away. Have you gone through that? It's just like you want to isolate yourself and lock away because you feel like your mood is so off and you don't want to say something, go piss off nobody, and you don't want to hurt nobody, you don't want to snap. So you just stay to yourself. And I should have put two and two together, but at that time you just say, oh, it's PMS, this. But when I saw month after month, and what started to happen with me in particular is that I started to have sleep disturbance. Sleep, I would just be in the bed, lying down, trying to go to bed, right? And the sleep won't come. And I could be tired and the sleep won't come. And then I started to get a little feeling in my chest, like, Jamaican people would call it a low feeling. That is what was happening. And I started to know, this was like, I want to say maybe 2 years ago, this is when it started for me. And I said to myself, at first I thought, maybe something I eat, us, we Jamaican, maybe something I eat or something I drink not agree with me. But then I started to observe a pattern. So another symptom, let me add it to the list since we're doing symptoms, is that the PMS, the premenstrual, before your period, that time before the period, tends to become worse, more severe symptoms, especially the mood symptoms, especially, the irritability and the sadness, and you're easy to cry and you're moody. Some women feel, we call it that hormonal feeling, bloating, and the breast them tender and swell up, and, it just make you feel so out of sorts. Have you experienced that? Tell me in the comments, because I'm reading comments today. Tell me, have you experienced that? So I noticed that, and at first I kind of shrugged it off, and I said, okay, hi Michi. And I kind of shrugged it off and said, oh, it's not a big deal. Maybe it's something off. But I started to keep, at first it was a mental record of what was happening. And I'm going to encourage all women to get a little notebook and keep a journal of your symptoms. It's very important because when you go doctor with some of these symptoms, it can look like other sicknesses. You understand? So, and we're going to go into more detail with the symptoms. But the point is that if you can keep a journal and you realize that there are certain patterns that happen, it makes it easier for you to figure out what really is happening. So you have those mental health, psychological, if you want to call it, symptoms. And they can be extremely, extremely difficult to the point that a woman might end up on an antidepressant medication, anti-anxiety medication because of this. It can destroy relationships, destroy how you operate your business, all for 1 to 2 weeks out of your cycle. Can you imagine? You become like a dragon, basically. Then now, you have the fact that it can affect your skin, make you more prone to rashes, acne, eczema, dryness, all kinds of things. Your skin get thinner, you're easier to bruise, your skin start to sag, And that's what I'm saying, from younger and younger ages. Let's talk about the musculoskeletal type symptoms now. All kind of aches and pains. I mean, you know, reach 60 and 70 yet for say, boy, wear and tear arthritis. But some women already having aches and pains. And you know what I noticed? Women are easier to get strained. Pull muscle, every little thing you lift this, your muscle, it's like you feel like you have a pull muscle. Crickety in your joints. The so-called frozen shoulders, right? All related to the changes at this time, the reduction in your estrogen and your progesterone sex hormones. Okay? Now, estrogen, that hormone, or hormone, these hormones are largely produced in our ovaries, right? And I want to explain, though, that the estrogen in particular is also produced in your fat cells, a little amount, and also in a gland called your adrenal gland. Now, I'm not tell you all of this information to just pack you up of information. There is a reason I'm sharing this information. So let me say this again, and somebody please just put it in the comment. Estrogen, or main hormone, or protective hormone in this sense, right, is made in your ovaries, but it is also made from fat cells and from in your adrenal gland. And I soon get into what those are. Okay? Your progesterone also is made in your ovaries. And I want you to understand that all of these sex hormones are made originally made from cholesterol. Cholesterol, you know, everybody say, oh, cholesterol bad for you. The same cholesterol is what our bodies use to make these sex hormones. So if you are cutting your cholesterol dramatically, you just know, say, your hormones are going to be low. So I'm putting that out there. So let us get back to some of the symptoms. Estrogen is very protective for the heart. So you will notice that you hardly do you hear women getting heart attacks in them younger ages. After maybe them reach 50 and above, you start to hear women having heart attacks and those things. Not true. It is very protective for our heart health. So as those hormones decline, you are at increased risk for heart issues, high blood pressure. You are at increased risk for diabetes and insulin resistance issues, pre-diabetes, diabetes, and what they call metabolic syndrome. All of that is related. You are at an increased risk for your bones getting thin, what is called osteoporosis, and therefore if your bones thin and you go boops and drop, you're prone to fractures, breaks in the bones. Okay? And this is very important, you know, because as you get a little older, 70s into your 80s, you find that women will get fractures for little and nothing. When I say little and nothing, I literally mean little and nothing. Compression fractures in your spine. One little drop your hip broke. And these type of fractures can be devastating for your quality of life and even for how long you will live. Understand? Good. So we spoke about the cardiovascular, I spoke about the bone. Now let us think about the genitourinary system. The risks again, frequent urine infections. And you might think, oh, a urine infection is not such a big deal. But as you get older and you're having frequent urine infections, you can develop what is called urosepsis, where this infection goes up your urinary tract, get into your bloodstream, and cause sepsis, bacterial infection in your blood. So you just think, oh, my hormones are declining. It's part of age. It's not a big deal. No, that is why I'm doing this video. It is more than that. It is more than just I am moody. It is more than just I'm miserable and I'm hot all the time and I'm sweating all the time. It's more than that. It is your quality of life as you get older. Your literal social life, because they have linked your social life with how happy you will be. Your loneliness. Will you be lonely because you can't get on with nobody because you're always miserable and moody? Then you're going to be saddy all the time. Are you going to have urine infection? You're going to drop and break a hip? You're going to have a heart attack, a stroke, cancer? You follow? It's all connected. Are we following? Then they talk about what is called the vasomotor symptoms. Those are your hot flashes. In my case, I was having not hot flashes so much, I was having chills, like I was just feeling cold. And I would say to my children or my husband, anybody else feeling cold? Because it would almost feel like you're catching a flu. It's a feeling like that, right? And then, of course, the night sweats, which, I mean, people will tell you about, like they will, and it can be embarrassing because you might be a high-functioning woman giving a talk or a speaker in a meeting and just this load of sweat you up. That I remember one lady said to me, she had to walk with change of clothes. When she got out, she had to walk with change of clothes because her night sweats, well, hot flashes really, were so severe. So those are the main symptoms, as we think about the premenopause. But I'm going to pause it a little. And I want to suggest to the younger women on this, and I hope younger women are listening, is that what sets you up for having such a bad premenopause syndrome is the hormonal balance. You hear the doctor talk about hormonal imbalance? The hormonal imbalance that was going on with you from your young, maybe from you were a teenager, from you were in your 20s, you had hormonal imbalance. But it was given different names in the sense of it caused different manifestation in you. For some women, they got fibroids. For some women, they got polycystic ovaries. For some women, it was endometriosis. For some women, it was dysfunctional uterine bleeding. You got different names, infertility. But a lot of this, if majority of this, points to you had hormonal imbalance from that time. And a lot of it, and I'm going to drop this like a bomb right here, a lot of it is precipitated by the contraceptives that women have used. It created a lot of hormonal imbalance. Okay? So I'm dropping some gems right now, So if you are in your 20s or 30s and you are having PCOS, polycystic ovaries, fibroids, bleeding, polyps, all kind of stuff, you are already in hormonal imbalance. Your hormones are not balanced. Therefore, you have a tough premenopause to look forward to and a tough menopause. Is anybody telling you this? Anybody explaining it to you? No, because nobody never explained it to me neither. But true, me no plan for suffer for 40 years of my life or 30, right? I needed some solution. So I have been diligently researching. And I'm going to say something to you. As nice, as sweet, as genuine as your doctor is, this is not something we are taught in medical school. Apart from the basics, we are taught the basics about, the menstrual cycle, what's normal, what's abnormal. But in terms of preserving a normal, healthy balance of hormones, I don't want to misquote, but I cannot recall learning this. Okay? Therefore, when you go with your bag of problem them, related to your hormones, related to your cycle, related to your reproductive health, they don't have many solutions to give you, including myself, because I've been there, done that myself. Going to tell you another story. I had a nurse friend. She was having severe issues with fertility. She and her spouse had been trying for a while. She endometriosis, had hormonal treatment, and her OBGYN, aka gynecologist, right, had said, at this point I'm going to have to do some surgical procedure because nothing was working. And I I want to say by the grace of God, because a lot of this information that I'm sharing with you today, as I say, is not from school. It is from my own research. And I believe a lot of what I've researched is God put it in my way. I call it divine revelation. And I told the nurse what to do. And I'm not exaggerating. Within 3 months, that nurse conceived. I am not exaggerating. And that is a few years now. Okay? I can go on with stories, Okay, very good. Anyway, and I can tell you about PCOS stories too. Anywho, that's not what we're doing today. So, as I said, if you're a younger woman and you're having what me just tell you, you are already hormonally imbalanced, you have problems, and you need to listen to this too. Very good. So, let us get back to what more I want to tell you before I get on to the actual hormones. So we go through the symptoms. We go through how it shows up. I want to touch on some of the causes of why women have hormonal imbalance, myself included. Hi, everyone. Yes, I miss Janine, Facey. Oh, you do, long time. So why do women have hormonal imbalance? So I already tell you one, birth control. Birth control is a major cause. And any woman who use birth control know what I'm talking about. It takes a while for your cycle to stabilize. After you use it, whether you use Depo-Provera injection, whether you use the pill, it takes a while. And some women, their periods never come back to normal. The foods you eat. If you're eating a lot of processed foods and you know them full up the food with a whole bag of hormone and chemical, that disrupts your hormones. What are hormones? Let me touch on this. Hormones. Hormones, think of it, are just messengers. They are signals. And you have different glands. The part of the body that secretes it is called a gland, right? So different glands secrete these messengers which signal to the body to do different things. You understand? It's just a messenger, but they are very sensitive. They're very delicate. So any disruption in your body can send off or create this imbalance that we're talking about. And the most common disruption, apart from those I listed in women, and let me spell it out, is stress, stress. Stress. Women know this. If you're stressed out, don't it throw off your period? Don't it throw off your cycle? Yes, it does. And we are living in a modern world of chronic stress, meaning we don't just have a stress because, boy, the money low this month and we can't afford the school fee. We stress for years on end. We stress at home with the man, stress with the picnic them, stress with the boss, stress with the on the road and the taxi man a bad drive you. You just stress. When you go to church, you stress. You just stress. You get me? So modern times we live stress. It's like most women live in constant stress. In constant stress. From your little bit nowadays, you go school, they might give you a pep exam, you have to stress out from grade 4, grade 5, grade 6, stress. High school, stress. Stress. You come out of high school, stress again, and then work stress. Background master slavery, stress. Stress to pay mortgage, stress to pay car loan, stress. And the hormones are extremely sensitive. And they are the signals that tell your body how to develop, what to do. This signal say, all right, time for the period to come. This signal say, time to release an egg, ovulate. This signal say, your breast need to grow. Your womb need to get, thicker, the lining. All of these things are signals and anything throws it off. The food we eat, the lifestyle, the stress we live under, the chemicals around us, the toxins, all of these things. All of these things. So when older women now, might say, well, my menopause wasn't so bad. My premenopause, I don't understand why them young people are so, highty-tighty. Because the decades they live their younger life in is very different now. It is extremely different now. Not to mention the radiation on the very phone and tablet we're using. The electromagnetic radiation, the blue light, them something are not good for women. Did you know that even your hormones, are sensitive to blue light from the phone. Did you know that? That the radiation, the Wi-Fi, your hormones sensitive to that? So all of that is what causes the imbalance. The food you eat with the chemical them, the toxins, and a lot of these act like what they call hormones in your body. They're called endocrine disruptors. They disrupt the normal, natural hormonal balance. Hey, listen, me for pay myself for all my teaching now. No, seriously, like if somebody did sit down and talk to me this way now when me younger, wow, what a gem, what a goal. I'm me for tell you. So let us move on now to the actual hormones problem now. All right? And there's a reason. I don't have time for waste. So there's a reason why I explain this. So what are the two hormones I told you about? The main hormones for women? Estrogen, progesterone. They are reducing. And the main reason you have hot sweats, hot flashes, night sweats, vaginal dryness, and them something there is usually due to the reduction in your estrogen. Soon come, hold on there. But you also get a reduction in your progesterone. When you have a reduction in your progesterone, that is what causes your mood swings. That is what keep you nice and relaxed. Your progesterone. So you say, all I wanna, who miserable, who cranky, your progesterone too low. You say, all I wanna, who having the night sweats and the hot flashes, your estrogen too low. Hold on there. Listen first. Your breast them swelling up, you're bloated, you're having headache closer to your period, you're having bad PMS, bad bleeding, likely your progesterone is too low. Pause there, so. Now, as I explained to you, because of what going on from in the 20s, and maybe before that, a lot of women, although the two hormones are reducing as you get older, your estrogen in comparison to your progesterone is high. Let me say that again. Although the two of them get lower as you get older, one is still higher than the other in ratio. The estrogen is higher than the progesterone in ratio. And we call that occurrence estrogen dominance. Listen, I wonder if now listen. Are you listening? We call that estrogen dominance, meaning even though your levels are lower than when you're younger, it's still much higher than the progesterone. And the ratio of the two is that the estrogen is dominant. And listen to me now. And when the estrogen is dominant, you're going to have a whole heap of problem. Cancer comes to mind when you have estrogen dominance. Breast cancer, womb cancer, uterine cancer. Big problems. Big problems. Autoimmune problems. Lupus comes to mind. All of these things, all of what we talk about, you feel hormonal, the fibroids, the bleeding, the endometriosis, the infertility, estrogen dominance. So it is not just that your estrogen and progesterone, which are the women's sex hormones, are reducing. It is that the ratio of the two, the estrogen is still too dominant. Those are the main hormonal problems creating the pre-menopause syndrome, so severe and so early in life. See me telling you the answer for the test already. See me telling you the answer for the test. So the solution for the test now is, how do we balance these hormones? How can I balance that my estrogen is in good balance with my progesterone, the way God designed it to be? And unfortunately, let me tell you something. One thing with men, and listen, I'm not going like what I say, but whoever cared what people thought. One thing with men, in a general way. They look out for each other in a general way. When you think about, champs, why the boys champs are always full? Because the boys schools always look out for them schools. Not true? And for men, when a man having like an erection problem, them in Jamaica would say them body now stand up stiff. Let me spell it out. Yeah? Which we know is a circulatory problem in the penis due to poor circulation. The older men will sit down with the younger men and tell them exactly how to get rid of it. You know that? Then we'll sit down and tell them which bush for drink, which herb for take, what for do, for fix them body. Did you know that? Did you know that? So those days when older women would teach the younger women, those days are gone, basically. So we do not have that guidance and wisdom that much. I'm not saying it's totally gone, of somebody to teach us, these are the bush and the herb, and this you have to do to make sure as you're transitioning into this now beautiful time into menopause, this is how you do it successfully and healthily. We don't have that. So we have to figure it out again, so to speak. Because I find as I've gotten older, I feel so much more like I don't care. Things don't bother me certain way. You can tell me I'm ugly. Who cares? I feel more in tune with my body. I feel like I understand things better. So at this stage, it's nothing to, oh my God, I'm getting there. This thing so wicked. This thing, may I get older? No, it's a time of life to enjoy, to make the best of it. So the solutions now. The first thing is your lifestyle. Your lifestyle. Your diet has to be clean. Your diet needs to be clean. So all of this junk food that people eating, all of the processed food that you buy in the supermarket, we come in the box them with the 1 million ingredient them where you can't even pronounce. Me can't pronounce it neither. The artificial colorings, preservatives, all of those things, and you're eating that day in, day out, that is counterproductive. Okay? So your diet needs to be rich in vegetables, fruits, as much as possible, organic meat and poultry, fish, and the like, as much as possible. As much as possible. You have to be deliberate with the food choices. And we are in Jamaica. We can get good food. We can. It might take a little more effort, but we can get the good food. You have to be deliberate there. You cannot outdo a poor diet when it comes on to this. May I tell you the truth? If you clean up your diet, you're going to feel a difference almost right away. Almost right away. Exercise. That, I don't even have to say that. You need to exercise. It don't have to be strenuous. It don't have to be, 1 hour in the gym constantly. Even half hour a day. Do some walking. Do some strength training. Do some stretching, flexibility. Move the joints so you have good mobility, stability, and balance. Right? Even half an hour a day. Do some exercise. Get some sunlight. At least half an hour of sunlight. Get some fresh air. Breathe in Master God oxygen. Look, deep breath in, expand the lungs. Then blow it out. Get it all out. Exhale long. Get it all out. Do that several times for the day. You have to do that. You have to take care of the one body God give you. If you not take care of it, sooner or later you're going to end up come to me for me take care of it. And you're not going to like the whole heap of pill and juke injection them. You hear me say? So prevention better than cure. Eat right, exercise. You know why I'm explaining how to eat right? Because most of we know nowadays don't even know what is food anymore. We don't even know what is food anymore. Okay? But this is not, I don't want to belabor that. So your lifestyle, your exercise, your stress elimination. Eliminate stress. Get rid of stress. Do not manage no stress. You are stress manager? You get a job for be stress manager? No. get rid of stress. I always say, if you make a list of your stresses, your stressors, the list can be 20 items. It can be, boy, when I rush to get the children ready, it stressed me out. When I have a credit card bill to pay, it stressed me out. Anything at all will stress you out. Make a list. Circle the easiest ones that you can fix and start one by one and fix the stress. So if rushing stress you out, start waking up or starting to get ready 15 minutes earlier so you don't have to rush. I did that. Because for many years, I was an on-call doctor. I'm always on call. I had to have my phone. Them can call me any minute, morning, noon, night. And I would have to get up and go. 2 o'clock in the morning, I have to go. And after I stopped doing that type of work, I'm telling you, my body is just like I was just tense. Your phone ring, you're just nervous. So I stopped rushing. I don't rush at all unless it's an emergency. So I had to correct that in myself. That's why I know what I talk about. So you don't manage stress because nobody now pay you to be no manager of stress. You're getting paid for being a manager of stress? No. Eliminate your stress. Get rid of them. One by one. Brick by brick. Little by little. As Dr. Jen said, baby steps. Those are the main lifestyles adjustment. And there's a reason for the stress thing. There's a reason for the stress thing. Because I mentioned to you earlier that your adrenal glands make estrogen. So when your ovaries stop making estrogen, that is why your estrogen levels drop dramatically as you get older, right? Your adrenal glands still making a little estrogen. But if you stress out, your poor adrenal glands go and burn out, so to speak. So you will not be making enough estrogen. So it's going to make your menopause wickeder. It's going to make premenopause wicked if your adrenals, because your adrenals produce the stress hormones, especially cortisol. So if you are constantly, chronically stressed out, by time it's time for now, in your 40s, you're getting ready for menopause, your adrenals going to burn out and you're not going to be producing no estrogen. So it's going to make that transition wicked. Wicked, me I tell you. Understood? Now you understand. Another factor with the hormones declining is that there's a close interplay between these sex hormones and which hormone up here, so your thyroid hormone. So when things not work well and your thyroid just decided nah, but I work, that is when your metabolism slows down dramatically. And of course, you put on weight and it now come off and your skin get dry and you're constipated and you can't, how did I forget these things? Memory loss, dementia, all of those things are worse because of that. As your estrogen drops, your progesterone drops too. Remember, it affects fat distribution. So all of you who did have Coca-Cola back shape, all of the fat got to your belly now. So you don't feel good in your clothes no more. And you have the muffin top, the belly hang over your waist. That's so. Right? Not true. So these are the things that you have to do to preserve the balance of hormones. The balance. It's not just to keep the levels up, but you want a good balance between the estrogen and the progesterone. Let us go now into supplements. So as I've told you, Dr. Jen, I believe in supplements because I believe most of the food we are consuming, we're not getting the right nutrients from them. I mean, I believe it. Okay. Now, when you are in premenopause, these you need. Let me give a disclaimer right here. So this video is for educational purposes. If you all want to say entertainment purposes, information purposes. I am not your doctor. You are not my patient. I am not giving you no medical advice. This is just for information. Okay? Please discuss everything with your doctor. Right? I am saying your supplements, every pre-menopausal woman, and I would add menopausal too, you must be on some B vitamins. You must be, especially if you are stressed, you must be on B vitamins, a good B complex, right? Including B1, B2, B6, and B12. And I like methylated B vitamins. I don't like them if they're not methylated. That's my preference. If you don't know what that means, you're going to Google it. I don't go to school and learn about supplements. This is from my own study. You must get B vitamins. You must do magnesium. Once you, especially if you know you're under stress, even if you don't feel stressed out, but you know your body is under stress, especially chronically for many years, you must be on some magnesium. You must eat a diet rich in magnesium, which are your green leafy vegetables, callaloo and them something there, spinach and them something there, rich in magnesium, right? And I just want to put this out there because I'm seeing a lot more cases of this. If you are vegetarian and you don't eat meat, says source of vegetable and fish, you must be on a B12. If you do not take a B12 vitamin, you are going to mash up your nerves then. Do you hear me? Go get your B12 checked if you are a vegetarian, right? Vitamin C is a powerful antioxidant. You must be, vitamin A is also very important, and vitamin E for health. So all in all, you want to get on a good multivitamin. And I would add magnesium separately because most people are deficient in magnesium. I love omega-3 or fish oil, because that's very important for brain health, to prevent dementia and all of that. Omega-3. Your B12. Zinc. I said zinc, magnesium, and your B vitamins at the very basics. You must be on those. Those are your baselines. Okay? Very good. I love cod liver oil. Cod liver oil has a good combination. Most of them have some omega-3s. It have your vitamin A. It have some D. I already tell you need to be in the sun at least half an hour to get at least 10,000 IUs of vitamin D. Early morning sun maybe is the best, right? Very good. I say all of that already. Not true. So this is your baseline in terms of vitamins that you will need. Now, obviously, depending on what is going on with you, would determine what exactly you need versus what I need. Not true. Because if you are bleeding a lot, you might be anemic. You might need iron, for example. I don't know. You follow? So it's all dependent on your needs in terms of the supplements. As it concerns herbal supplements, yes, I believe in them, but I will give you a little caution with them. What works for you might not work for me. So you have some people who swear by evening primrose oil, for example, but for some other people, that don't budge them. Black cohosh might help you, but it don't budge another person. You follow? So there are herbal supplements that will help, might help, but that is also very individual. During this week, I will be making more posts on my social media with more of these supplements that you can do your own due research about. Okay? I love ashwagandha. I'm not saying you should take ashwagandha, but I love ashwagandha. If you are chronically stressed and you have anxiety problem, and ashwagandha might be helpful. Cordyceps might be helpful, depending on you. I am not a herbalist doctor. I did not go to herbalist school. I am just telling you what I have used on myself, my family, from my own research for information purposes only. Okay? So yes, herbal preparations might be helpful. But let me tell you something. If your liver now work properly, because you have fat in the liver, which is the most common reason. Fatty liver. So you know you have a big old gut in front of you. Chances are you have fat in the liver. it is likely that your liver is not functioning properly. And you have to be careful with using a lot of these herbal stuff, even the pharmaceutical drugs, if your liver not working properly. So you may need to consider, how do I optimize my liver? And there are herbal supports for helping to get your liver back to scratch, up to scratch again. Thinking of things like milk thistle, tudka, and the like, but that is not in the realm of what I offer, okay? But I'm giving you a starting point, because if your liver not working, chances are your estrogen is going to be high, right? Relative to your progesterone, you will have estrogen dominance. You're going to have gallstone, all kind of issues when the hormones are out of balance. Even into your premenopause time, you're going to have these issues. Even though the levels dropping, but because the balance, the ratio is off, you can get these issues. You see what I'm saying now? Good. Now let us go into the medications that are sometimes offered to women in their pre-menopause. Now, because a lot of these issues look like, regular issues, a UTI look like a UTI. Excuse me, throat going. Hold on there. Let me go and read some comments while my throat recover. Centrum Silver. I would say, for the multivitamins, I use this brand called Life Extension. I got it on Amazon. I'm really impressed with it. That's the brand multivitamin. Yes, I like ashwagandha too, Marsha. Cauliflower, what about it? Yeah, it's a vegetable. All right. I think my throat is back. So now let us go to the medications, right? Now, as I was saying, because a lot of these symptoms look like a regular illness, you will keep going to doctor for various issues. You're going to go because your shoulder hurt you, right? Frozen shoulder. You're going to go because you have a UTI or you're bleeding, and I'm going to give you some hormone pill to take to stop the bleeding. And, you're just going to disrupt the balance even further. My approach generally for myself and to the patients who come to me, right, is that we aim to obtain hormonal balance as much as we can. Okay? Not everything we can control. But if you think about, even because sometimes even the lotion you're putting on your skin and all of that, so many factors, right? So your doctor may be giving you an antidepressant because, you're depressed. You might be getting some Xanax or Valium because you're having panic attacks and you can't sleep at night, right? So generally that is the approach, and most commonly when you have period irregularities, your doctor going to give you a minigyne and a birth control pill to try, make the periods, you don't bleed so heavy and all of that. Not true? Yep. You're going to do an ultrasound, and the ultrasound going to show if you have an ovarian cyst, or if you have fibroids, or if you have a polyps inside of your womb, endometrial polyps, it's going to show all of that. Don't explain how all of that happen. But let me tell you what is really, really needed medically. And true, me know enough and I love magic pill and magic bullet. This is not a magic bullet condition. Okay? This is years of taking it to reach this point. It's years to fix. But the best thing you can aim for is called hormonal. Listen before you judge. We listen, we don't judge. Hormonal replacement therapy. Listen. With bioidentical hormones. Can somebody type that in the chat? Hormonal replacement therapy with bioidentical hormones. Bioidentical hormones. So when you see your gynecologist, have a discussion and say, I've heard about bioidentical hormonal replacement therapy. Am I a candidate for that? Notice I did not say the regular hormonal replacement therapy, not the regular HRT. And I'm going to say this very deliberately. The HRT, which stands for hormonal replacement therapy, they used to use synthetic hormones. They still use actually synthetic hormones. Synthetic hormones are hormones that are made in the lab, right? Just like how you have birth control pill. Those are synthetic. They are not natural. Okay? And the most common estrogen is Premarin. You've heard of Premarin. And then you have the progesterone, progestin. These are synthetic, okay? And these are what they usually use for HRT. There is a caution with using these things as it concerns the risk for cancer, okay? I am not in no way or form suggesting those. I am talking about bioidentical hormones. These are natural hormones that are literally like what is in a woman's body, natural. And you'll hear them talk about the wild yam. Have you heard of wild yam? So I'm not talking about the actual wild yam, but they actually extract it from natural sources like the wild yam. And they have progesterone and estrogen that you can get as bioidentical hormones. And because most women are deficient in progesterone hormone, especially relative to the amount of estrogen they have, many women benefit from progesterone, natural bioidentical progesterone. And you can get that even in a cream form. Nowadays, them have it as a patch, tablets, cream. I think they have vaginal inserts, but you have to have a discussion with your doctor. The cream, you can get even that online. You can get even that online once it's a natural bioidentical hormone. And I find that is what the nurse used, the one that I told you could not conceive. And within 3 months, because she had endometriosis. And with 3 months, I said 3 months. I don't even think it was so long. Because I'll never forget when she called me. I'll never forget it. I was so shocked when she called me. I literally said, "What? You breed? Already?" That was my exact reaction. They couldn't believe it. And this was a woman, a young woman, who was going to her gynae, who had gotten all the regular hormonal, injection them, which are all synthetic, and all of that. And her last thing was she needed to go get some minor procedure with blah, 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 blah. And out of desperation, she come to me. Remember, I'm a family doctor, but through she know me kind of will analyze her case and try to figure it out for her. And I did, by the grace of God. That is what got me on this journey. And I told her to try the progesterone, the natural progesterone. Within 3 months. 3 months. Yes, it's just because of her privacy, because I would ask her to come on my live and just tell you her story. And you cannot outdo your lifestyle. Let me tell you about lifestyle. And another lady that I've worked with, not a nurse this time, but somebody that I've worked with. She and her spouse trying to conceive, having great difficulty. She came to the office and said, "Doc, me and my spouse, we want a second child, but I have polycystic ovaries," which is another hormonal imbalance issue. It's a hormonal imbalance issue. I'm going to do a live on PCOS one of them days again. Anyway, she couldn't conceive, having challenges. Same story, same boring story. Right? And it's hopeless, and she's going to have to do some procedure, and blah, blah, blah. And if it reach, they might have to do fertility treatments, and you know how that go. And I'm telling you, I didn't even give her no medication. You know how them give metformin? None of that. None of that. What I did, I put her on a diet, on a very restrictive diet. It had to be organic. It had to be extremely low carbohydrate because, you know, with the polycystic ovaries, there's that risk, that insulin resistance, that risk for diabetes. So I restrict our diet, everything. I don't even think we did reach exercise. I don't think it's 2 months before she breed or conceive. I don't think it was 2 months. Couldn't even believe it. And for the most part, she kept up with a low carb diet, even during the pregnancy. So that she would not develop gestational diabetes, meaning diabetes in pregnancy. So she did the low carb during the she wasn't strict, you know, but she did mostly low carb during the pregnancy, and she had a very good pregnancy. You know, very good pregnancy. And a lot of these issues, reproductive issues in women, stem from hormonal imbalance, of which the severe premenopause syndrome that we're seeing in women is largely due to that, set on a foundation from childhood, teenager, that we were eating the wrong stuff, living a wrong lifestyle, surrounded by toxic stuff. So it damaged that nice balance, that dance about, you know, like how a man and a woman would dance together. That balance was off from those early days, and now we are suffering with it. So to correct that, you know, it will take some time. And to be honest, for me to learn this in my 40s, I'm in my 40s, and for me to learn it at this stage, you know, it would have been nice if I knew this like 20 years ago. But maybe this video will help a younger woman to have a better, you know, a better experience with her reproductive health. All right, so that is all I have to say. Let me just summarize. It's that the premenopause syndrome is largely due to hormonal imbalances between our sex hormones, estrogen and progesterone, all due to our lifestyle, the toxins we are around, stress being a major one, and even chemicals we put into our body like medications, birth control, etc. We now, with the knowledge we have the opportunity to right a lot of these wrongs with our lifestyle, with the foods we eat, the exercise, stress elimination, with supplements, with optimizing our nutrients and minerals. How did I forget to talk about the minerals that we need? And with various herbal supports relative to our various issues. There is a role for bioidentical hormones, which are natural hormones, particularly progesterone, and in some cases, bioidentical estrogen, but that must be taken with progesterone, depending on what's going on with you. I think this has been such an excellent talk, if I may say so myself, because boy, if somebody did tell me this 10 years ago, you know, if, you know, knowledge is really power. If somebody had told me this, let me see, maybe 15 years ago, I would have healthier pregnancies, healthier postpartum, you know, just a better life. You know, wouldn't suffer from the PMS, the moodiness, all of those things. Not true. The easy weight gain, this and that. You know, so now you know. Now you know. All right. So do we have any questions? You are most welcome. You are most welcome. And I'm glad that you found it helpful. Please do share it. If you love it, share it. And it is very encouraging when I see that it is shared, because it gives me the vibes to come on and do more videos. You understand? So if you love it, that's all I'm asking you to do. Just share it. Press the like. No, don't press the like. Press the love. What you call it? The love button, not like. We give love. We give love, not like. And the next video, what do you want me? This is my last question. What would you like me to teach on? Here are your options. I could teach on the polycystic ovaries if you'd like. I could teach on anxiety, or I could teach on stress. They talk about the stress hormones, cortisol, and how it affects you. So of those three topics, which one would you like me to teach on next? Polycystic ovaries, PCOS, anxiety, or stress, adrenals, adrenal function, adrenal fatigue, stress. You're most welcome. Okay, Arlene says anxiety. You're welcome, Jackie. Heart was one. Oh, yeah. Thank you, Denise. Very good. So now that you have learned, or you want to learn about the stress hormones, yeah, man, that stress hormone thing, Marlene, is very important, the adrenals. That's why you see a lot of people burn out and tired, and it can really mash you up. It can really mash you up. You don't have no energy to do nothing. You know that so-called chronic fatigue? It is that. I'm going to put it on YouTube. Anxiety. Most people saying, I'm still anxious. All right, I'll do the anxiety. Most people saying anxiety. All right, so when you get a chance, listen back to this video, take notes, and have a discussion with your doctor. You don't need to suffer. Remember, the complications with these can be life and death, eh? So you don't need to suffer. And by the way, I actually used my advice, and may I tell you, I don't have the chills anymore. My PMS is much, much better, much better. Maybe only a day or two kind of rough before the period, but overall, it is so much better mood, much, much better sex drive. May I tell you, that was suffering. That was suffering. Don't tell my husband, me tell you. But may I tell you, I said that was suffering. But that has improved. So it has helped me. Everything, may I tell you, I can tell you, say it works. It works. Have a discussion with your gynecologist or your doctor. Do some research on your own and be well. Until next time, this has been Dr. Jen from drjenmed.com. Be blessed. Bye.